All right, I see people coming in, so we'll get started in just 1 second here. Good afternoon. Thanks for joining us for Innovative Partnerships Collaborating for Community Decarbonization. I'm Emmy Luck, Energy and Climate Associate at NEEP. And to get started, I'll just give a brief overview of who we are and why we're here today. So NEEP, Northeast Energy Efficiency Partnerships, is a regional energy efficiency organization working with leaders across the region to decarbonize our homes and buildings. NEEP works to drive market transformation by fostering innovation and collaboration, developing resources and tools, and disseminating information. Before we get started, I want to thank our funders and network of allies and state partners. These relationships help to guide the work that we do throughout the Northeast and Mid-Atlantic region. With this webinar series, NEEP is supporting our many stakeholders who are working to address carbon emissions from existing building stock with this low carbon retrofit solutions webinar series, of which this is the last session. The first one focused a bit on benchmarking and on building performance standards, mainly for jurisdictional buildings. And the second in the series presented a variety of perspectives on home energy labeling solutions, including minimum efficiency standards. If you're interested in these topics, check out the recordings, which are linked here in the deck, or our interactive benchmarking dashboard, which has updates coming soon, and our upcoming residential labeling dashboard for more information. The topic for today's session, collaborative approaches to weatherization and whole home retrofits, was born out of research that I've been doing on equity and the decarbonization of our building sector. And this really rose to the top as one of the issues that I wanted to focus on in this series, since weatherization is so important for building decarbonization, and there are several barriers to that can be addressed through innovative partnerships. So the intent for today's conversation is to learn from some of these program experts who are implementing programs to enable comprehensive energy retrofits. There are several barriers, as I mentioned, to this work, including application barriers and health and safety issues, which can be addressed through some of these innovative partnerships and program approaches, which we'll hear about today. We'll begin with a 5-minute description of each of the speakers' programs before diving into a moderated discussion about whole home solutions, where we will spend most of our time. And Tony DePrima will speak to the Energized Delaware Pre-Weatherization Program. Erica Brown will speak to the Triangle J Council of Governments Partners in Home Preservation Program, all the way from North Carolina. And Jamal Lewis will speak to New Jersey's Whole House Pilot Program, as well as a few other programs that he's been running with the Green and Healthy Homes Initiative. And as always, please remember to submit your questions through the Q&A panel, and we will get to those throughout the discussion. So first, I will introduce our speakers for today. Jamal Lewis is the Director for Climate, Energy, and Health at the Green and Healthy Homes Initiative, where he leads the organization's energy efficiency portfolio and works on the national lead campaign to end childhood lead poisoning. DHHI takes a whole home approach to align services and funding and to coordinate service delivery and provides policy and thought leadership in addressing the social determinants of health and the advancement of racial and health equity. Dr. Anthony DePrima has been the Executive Director of the Delaware Sustainable Energy Utility since 2011, which is a unique nonprofit that aims to create a sustainable energy future for the state. Through its Energized Delaware initiative, it helps Delaware residents and businesses save money through clean energy and energy efficiency programs that also reduce carbon and other air emissions. And Erica Brown is the Housing Program Manager at Triangle J Council of Governments, a regional planning organization for 7 counties and 46 local governments in North Carolina. Erica currently supports local government efforts across the Triangle region relating to preservation and creation of affordable housing in connection with equitable land use, transportation, and infrastructure planning. So I'll now invite Jamal, Tony, and Erica to join me on the screen. And we'll begin with a few brief presentations. And I think I'm going to ask Tony to go first, followed by Erica, followed by Jamal. And we're going to do no more slides for now, so I'll stop screen sharing so we can see all of our faces. So
Great.
with that, Tony, do you want to give us an overview?
Thank you very much. We really appreciate, I appreciate the invite here and to be with a great panel. I think this is a wonderful subject. Just a very little bit about us. I think you've already mentioned that, you know, we are a nonprofit, we're a 501c3, but we were uniquely created by the state of Delaware to deliver energy efficiency and green energy programs across the state, across all sectors and all fuels. And, you know, the subject today are partnerships in the community, and almost, you know, our whole corporate model is based on partnerships. We run over 20 programs, and just about every one of those, it's because we formed either a partnership with a private company that has an expert in the field, or with a nonprofit with an expert in the field. And so, you know, we have many relationships with, you know, nonprofit organizations here in Delaware. Some of them are national organizations, like New Ecology is a nonprofit. They run our multiple family program. Interfaith Power and Light runs a program for houses of worship. So we have developed literally a dozen of those relationships. I think what caught Emmy's interest was our pre-weatherization program. And I really can't speak to that without really saying, how do we get somebody into a pre-weatherization program? And it's all about partnerships and networking. And it is about equity and working in communities that are traditionally difficult to break into, to form trust with. So really our program, I'm going to take you on a very quick journey, but it starts with a knock on a door in a house. And let's say a community in need. And this community has already been briefed. We've partnered with a local community center leader, somebody from the local church, maybe a local political person. People have trust in the neighborhood, and we've already gotten the word out in the neighborhood. We're going to be knocking on doors. We knock on doors and we simply ask folks, could we put an LED light on your porch light? And that's the way we start conversations. And through those conversations, by opening the door, giving these folks an LED light, which is our Light Up Delaware program, in partnership with a nonprofit called Help Initiative, you know, we are now breaking through to that homeowner. And through that early breakthrough on installing a light, we then go to a conversation about other energy savings programs we have, not just an LED light making their home brighter and safer. So from there, it's a conversation. Well, we have a counseling program, home energy checkup and counseling. Are you interested? We bring, from there, we work with the homeowner. We then get an energy counselor in with perhaps one of our other nonprofit associates, Habitat for Humanity being one of them, that will then come into the house after the trust is built, and we'll work with the homeowner. We'll look at their bills. We'll do a very basic energy audit of the home. And then we'll counsel them on programs that are available for them to save energy in their house. And then that leads to weatherization, right? One of the biggest programs in the nation for helping people weatherize their house. And so that leads to weatherization, which is run by another nonprofit called the Energy Coordinating Authority, who is contracted with the state of Delaware. But oftentimes what we found in Delaware is half of the time these homes being referred to weatherization were getting deferred because a roof leaked, old electric, poor foundations, dirt basements, all kinds of reasons for deferral. So then we set up a partnership with the Energy Coordinating Authority for a pre-weatherization program, where we are now funding through our RGGI funding that we get, fixing up roofs, fixing old electric, fixing holes in walls, things that weatherization won't cover. And we're then leading them to then enroll back in weatherization. So in this short story, from knocking on a door through to pre-weatherization and weatherization, we've touched about 4 other affiliated partnerships that we've created: Habitat for Humanity, Help Initiative, the Energy Coordinating Authority, and then Franklin Energy, which is our company that also provides sort of the backup for the programs. So just a quick example of how we've touched many partnerships in our organization. And it's all about starting with trust in a community and building that. And you only do that through community partnerships.
Great, thank you. Yeah, I'm glad that you touched on how important it is to build trust and use our trusted community partners to build those relationships rather than just going into a community and pretending to know what they need. So I think, Erica, maybe you can speak a little bit more to that in your introduction of your partner program, since I know that you have a lot of community-based partners involved.
Yeah, absolutely. Thank you so much, obviously, for having us and talking about our preservation program down here in North Carolina. So as Emmy mentioned in my introduction, just to give some background, we are a regional council of governments. I'm not sure, some states have them, some states don't, but essentially we provide technical assistance to local governments within our footprint. So we have 7 counties, nearly 50 governments. And a lot of our housing technical assistance work is also in partnership with our home repair work. So we provide home repairs, which is kind of how we got into the program that I'm going to describe. So as previously mentioned by Tony, and I'm sure so many people on this call understand the deferral issue with weatherization, primarily caused by urgent repair needs like a hole in the wall or the floor, a roof leak. These really restrict what organizations that provide weatherization can do, even though they have the funding and the capacity, right, to administer these programs. So we were really finding that within our community. And in addition to that, we were noticing, hey, we ourselves are providing this service for repair, but we are not the only people doing this. There are many other organizations within our communities that are doing almost the exact same thing. We're adjacent, providing adjacent services. And so we really had this issue where I feel like there was a lot of inefficiency, and we had an opportunity where there was funding to address some of the issues that would cause those deferrals, but we weren't necessarily all communicating in a really effective way. So starting 3 years ago, we started to receive funding from Southeast Energy Efficiency Alliance out of Atlanta. They were really interested in helping us come at the deferral issue by creating a more collaborative process with all of these organizations in each county. So we started with a pilot program in 2 of our 7 county region. And there, what we really did was try to think about ways that we could improve the process, both for the individual organizations to make them more efficient, and also for the homeowners and the clients that we're serving. Because they are often, right, low income, they might not have time that it takes to interact with a lot of different agencies to figure out which is the one that's going to be able to provide me assistance. So essentially, we started to think about these tools, right? And there's a suite of them that I'll talk about briefly: a unified application process, a whole home assessment, a shared online database, and then we also had regular meetings with each other, and we created an evaluation process to kind of determine the outcomes and whether we were successful, right, in this pilot project. So just going to give you a little more information about each of these tools because I think that might be helpful. The unified initial application, we understand that all of these individual organizations have their own intake processes already. So coming together, was really difficult. Essentially, some people who only needed to have the name, address, and somebody's age, right, if they were providing accessibility modifications, is very different than somebody collecting information, pre and post energy data for weatherization programs, right? So we created this initial application just to figure out if somebody would be eligible for any one of the programs within each of the counties that we did the pilot project in. And then as soon as that was completed, it triggered a whole home assessment. So rather than having each individual organization go out, look at the home, determine if it's, a viable project for them to take on, we had one person funded by the grant that we received doing all of the home assessments for any person who came into the collaboratives group. And essentially with that, it allowed us to come together, both in person and by putting all of this information into this online database, which by the way, we used Airtable as a platform, if that's helpful. We were able to have all of the information we needed for people to make decisions up front, to help leverage funding, to make sure that one, we reduced deferrals, and two, we weren't doing one work to patch an issue and then later somebody else is redoing the work of that person because it wasn't properly coordinated, right? So I'll just wrap up and say that pilot project was really successful. We still have those collaboratives going on in both of those counties. And within this last year, we were actually funded by North Carolina's Department of Environmental Quality. And basically, they were really interested in exploring how this collaborative process could work across the state. We reached out to other councils of government, and really they're kind of working on their own right now to implement their processes with some of the tools and lessons learned that we have. And then we were also able to expand that into 2 other counties within our footprint. So we have 4 collaboratives right now, hopefully more across the state. And honestly, it wouldn't be possible without those partners. So thank you. I'm happy to answer any questions later too, of course.
Awesome. That's great to hear that it's already kind of scaling up and expanding this footprint. That just lends to the success of the program that we can clearly see. And I'm excited to dive a little bit deeper into that unified application process and how all of those moving parts work a little bit later on. Thanks for that. Jamal, do you want to give a brief overview of the program that you're working on and any of the other ones that you want to mention as well?
Yeah. Thanks for having us here, Emmy. I think this is a really important conversation to have. Again, I'm Jamal, the Director of Energy, Climate, and Health for the Green and Healthy Homes Initiative. And I think it might be helpful to start with the sort of the evolution of the work that we do. We started off as a coalition dedicated to ending childhood lead poisoning. We started off as the Coalition to End Childhood Lead Poisoning, CECLP, and had been doing that work since 1993. But then in 2009, organization, a lot happened between 1993 and 2009. But in 2009, the organization received a grant from HUD to start this comprehensive retrofit program, and that was known as the Green and Healthy Homes Initiative. And so our name actually was just an initiative that was started out of HUD. And the point of that initiative was to scale some of the work that we have been doing in our flagship office in Baltimore to align, braid, and coordinate existing resources to remediate hazards present in a home and to improve the energy efficiency of a home. When we were going in performing environmental assessments to identify lead-based paint hazards and going in to remediate those hazards, which to this day, we have staff that goes in and does both of those things. We were noticing that even though we would remediate those hazards, we would check in with them and follow up, and we had found out that many of those clients had to move, and so they weren't actually benefiting from the remediated lead that was present. We found out that one of the primary reasons why they had to move was because of high energy bills, and so that led us to explore starting a weatherization program utilizing state funding and some federal funding as well. And that's when we started to realize how much of a challenge it is to weatherize homes that are older and that may have other issues present there. So fast forward, we have this initiative to align, braid, and coordinate lead poisoning prevention resources, asthma trigger reduction resources, aging in place, and our weatherization program. And what we do is we try to, again, align, rate, and coordinate all of those programs so that no matter which program a client comes in or as comes into the initiative, they're able to receive all the possible resources that they could use. And the grant from HUD allowed us to expand that idea to about 10 other cities across the country. And the premise is we want everyone who currently does not live in a quality energy efficient home to be able to receive the resources to be able to upgrade their home. And it's a challenge, but there's a few key components, some of which Erica mentioned in her intro, is having a coordinated intake program, having either a coordinated audit process or assessment process, or one person that can do all of it. There's an evaluation tool that's important to determine what the outcomes are. And then, having cross-trained contractors that can do things like lead remediation, mold remediation, and can also shift gears and install, more energy efficient technologies too. All of that is designed to make the process more efficient for the homeowner or for the client. And those are the basis for the whole home type retrofit programs that we've been involved in, and that underscore what we're aiming to do with the whole house pilot in New Jersey. That program is a statewide program, so it's different different than many of the other efforts that we've engaged in that have been more locally based. This one has an intention of being a statewide program, but it's currently a pilot that we're working with the Board of Public Utilities to develop. So it's still in the development phase. There is going to be a pilot set in one municipality in New Jersey. But the idea is that the state has its own funding for retrofitting affordable housing, or for creating affordable housing, or as pass-through funding from the federal government. But all of those, there's about 20 to 24 different funding sources that can be used to create a holistic housing retrofit program to support pre-weatherization and other weatherization measures. But they're all siloed, as Tony and Erica had mentioned. So the idea is how can we create a process that would unsilo these programs and get them to work better together to better serve the residents of New Jersey. So that's the idea. It's not a new idea, right? I mean, this has been, folks have been trying to do this. We've been doing this in different cities, and it helps. It does reduce overall cost of the project, and residents walk away even happier with the work that's done, because they're not only receiving energy efficiency work, but the mold that's there is being remediated, lead-based paint is being remediated, and there's improved thermal comfort, just to name some of the benefits. So partnerships are key as we talk about working with utilities, as we talk about working with contractor firms that go in and do the work, as we talk about, as Erica and Tony both mentioned, no matter where someone enters the system, you want them to be able to get the resources that they need. And that requires warm handoffs with the intake. It requires shared data platforms if possible, and all that good stuff. But I'll stop there because I know we've got plenty of time for discussion.
Thanks. Yeah, I think you hit on a lot of the really key points that we want to talk about today, and how the importance of braiding funding and resources also stems to the importance of braiding relationships and the work that we can get done together. So that's really great to hear, and I'm excited to hear more about each of those programs. But You mentioned the importance of dealing with health and safety issues in addition to just weatherization work. And I was just thinking more about Erica's program and the walkthrough that you mentioned, the energy audit. I was wondering, is there kind of a health and safety component to that audit? And is there a healthcare professional involved in that, or how does that look? What does that look like?
Sure. So it's still the same organization who has been doing all of these home audits. Basically, have a goal of trying to do all of the things like accessibility, repair, health and safety concerns, try to do that. And then they also talk to the homeowner about what they think is important. And from their perspective, try to, if they have accessibility needs, try to also manage that with the homeowner, their input and how that process, basically having them a part of that process the entire time. So it is a part of that. We also, since the pilot project has begun, that organization has hired a occupational therapist as well. And in at least one of our like county-wide collaboratives, it is actually run by the Department on Aging, and the person itself who's running that collaborative is an OT as well. And they're very focused on the health and safety aspects, especially for older adults, but for everybody.
Great, thanks. And then maybe we can start with you and then kind of go around the table, but we've all talked a little bit about how the stakeholder needs were really key to centering those stakeholder needs were key to creating each of these programs and making sure that the resident needs were being served. So I want to hear a little bit more about how you listened to the stakeholders throughout the process and engaged with residents throughout creating the programs.
Yeah, it's interesting because we actually started several years ago. Our board, my board of directors, decided that we needed to do more in our low mod income communities. And so what we did is we put together focus groups in each of the counties. And there's only 3 counties in Delaware, so that wasn't hard. But so we put focus groups together where we try to get leadership from those communities or people who are providers who work with low mod income communities. And we came up with a list of 4 actions that we were going to take as a result of the focus groups. But the number one that came up is that's where we learned about the deferrals. And quite frankly, I was shocked. I had no idea how many properties were getting deferred and basically putting in a file box. So it started with us on a focus group.
Sure, I'll kind of piggyback off that. So obviously each individual organization is hearing certain things from the clients that they would like to serve. We had a lot of wait list issues and sort of like backlogs, especially when it came to the repair needs that needed to happen before the weatherization could happen, right? But I will say we mostly engaged residents, aside from when they came through our system, naturally in our program evaluation stage that we did with the pilot project. So we tried to implement sort of a pre-assistance survey, really, and then a post-assistance survey, really to see, how different parts of their lives have been improved or worsened or changed or not changed. And that actually led us, one part I didn't mention, to really focusing on referral resources. So not only having the people who provide the services we talked about, but also being able to hear, the other concerns in their lives and refer them out, whether that's for, rental assistance or, mortgage assistance, even COVID shots, things like that. So yeah, thank you.
Great, thanks. Jamal, do you want to add anything?
I can add a bit, but I think both Tony and Erica covered some of the main tools, pre and post questionnaires or assessments, providing some form of a feedback loop to get feedback about, you know, how the work is going, what other needs aren't addressed. And I think the piece that maybe isn't, that I would like to see done more in programs is making sure that it actually is a loop and that we aren't just receiving feedback, but are actually talking and updating community members about what's happening with their feedback. Because I think, you know, in the experience that I've had, soliciting feedback can be really helpful, but then community members start to wonder, like, what happened with that? You know, what are you doing to ease our concerns? And if there isn't a report out, that may discourage future feedback. So I think, in addition to what both Tony and Erica said, it's important to just report back what you're actually going to do, and we try to do that with our work.
Could I just add one more thing related? As you were talking, I was thinking, yeah, we could do better about that. So we actually learned that even though it was really good for the service providers to be communicating more, homeowners, I think when we got feedback from them, they would say, you know, it feels like I'm just submitting my application into like the ether, right? And like we don't know who to contact, because now all the organizations are possibly looking at my application. And so that's a challenge that we're still dealing with. We were able to, as a group, try to implement like a prioritization process, which is still kind of ongoing for who we're going to help and when. And that will allow us to share that in the database, put that information in the database. So if that person calls anybody, that information is accessible. But yeah, it is kind of on a request only type of situation, which I think is really challenging for people, especially, you know, if they actively really need assistance.
Great, thanks. So Erica, you mentioned evaluation before, and Jamal, you alluded a little bit to how we think about metrics for success. So I was just wondering if, Erica, I know you have some real metrics established for this program. Jamal, I know you're still kind of at the beginning of this program, and Tony, I think you could speak a little bit more to that program as well, since it's been around for a long time. But I'm wondering if any of you have established metrics for success that you use for these programs, or if you've started thinking about any.
So I'll take a shot at that. So depending on the program, again, I mentioned early on that our funding is through RGGI, and RGGI doesn't actually put a lot of restrictions and requirements on the use of funds, unlike a public service commission, which Jamal had mentioned, or perhaps some other funders. So for the actual pre-weatherization, we're really just interested in the number of people being helped. So we look at just numbers help. We're not interested in claiming energy savings, because it's always debatable if I fix a roof and that leads to weatherization. But our other programs for our HELP initiative, we know that by replacing an old incandescent light on a porch light, even though we design it so the LED is light sensitive, so it goes off during the day and on at night. And then we work with them on their switch so that it discourages them from shutting off the light. So the idea was safety in a neighborhood where you light up a whole street. But in that, we knew that there's energy savings. So we would hire a third-party measurement and verification company to develop the energy savings per bulb installed. So they go through the magic of M&V. So where we can, we do use third-party M&V contractors to claim energy saving.
I think our situation when we did the evaluation is a little bit different, because we were in some ways required to report on the outcomes of both how homeowners felt they were being assisted, but mostly on the process improvements, right? So, because that's what the funding was for. So we did do the pre and post sort of surveys with the homeowners. And overall, I mean, I think we mostly talked to them about it wasn't necessarily like do you still have asthma or things like that. It was more how they felt about their home and their safety and things like that. And I think we went through a lot of iterations of that, but overall, it was definitely more focused on them than in like their perspective. And I think that is helpful for us and has been helpful for us to sort of make those small changes iteratively. The process piece, we really focused on obviously the reduction in deferrals. The wait times is kind of funny because like now I think we're all of our wait times are funneled into one system. So it actually seems like a little bit longer in some cases. And it also, because we're helping more people more holistically, their projects just take longer because we're doing more. So I know this is more of me just saying like, I don't know that we did it right. I think we're really still struggling with how to show that, but we definitely track, you know, how many organizations are working on a project, you know, how much funding the collaborative as a whole has been able to attract since we have implemented these processes, which is actually quite a lot, and things like that. But we don't really focus so much on the energy piece. We don't really have the tools to do that in-house, but I think that's a really important piece that I wish we could do.
Yeah, it makes sense if it's focused a little bit more on the health savings rather than energy. Jamal,
Yeah.
I know your program is a little bit new, but I know you love metrics, so I know you've got something for us.
Yeah, and even though that the whole house project is underway, the development of that, we have worked on numerous other programs too, and I love Erica's point about process, right? Because you know, part of the strategy to reduce how costly, you know, these programs are to serve more people is how can we actually streamline some of the process flow. So, you know, yeah, wait times, you know, how do we reduce the number of times that we actually have to go to a home is a big one. So I just love the point about process, Erica. Well, there's also, and about health, right? Health outcomes are a burgeoning element of this work, particularly as we're relating to like pre-weatherization, which often involves health hazards like lead, like mold, you know, electrical hazards too. And I think there for some time, for the past several years, there has been a movement to, you know, track and understand what non-energy or co-benefits come as a result of weatherization or energy efficiency. And when we don't just do weatherization, when we do pre-weatherization, those co-benefits can sometimes, you know, be exponential, right? When you talk about someone with asthma or an older adult who may have a risk of falling in their home and may have resulting healthcare costs as a result of that. Well, how do we connect like these metrics to furthering the impact that these programs can have, I think is important. So the more that we're able to prove out that both weatherization, energy efficiency, and pre-weatherization has health outcomes, the more that we open the door for healthcare entities to see a role that they could play in this type of work. And we're seeing a trend with more healthcare entities like health insurance companies, hospitals or health systems, even like state Medicaid offices or the CMS, the Center for Medicaid and Medicare Services, saying, yeah, we're doling out trillions of dollars in reimbursement costs for preventable diseases or preventable conditions. So if we invest in upstream measures, we can reduce the amount of money that we spend addressing these preventable illnesses. But all of that is built on the back of collecting data and tracking metrics on how well these measures improve health. how well these metrics improve other societal issues as well. So, so beyond that, I also want to just touch on the fact that we've also been tracking like where investments go, where within the target jurisdiction investments go, because we know that there are historically excluded communities that don't receive the share of these benefits as they should. And so to make the case for more targeted investment, it's important to understand historically where these investments have gone and how can we shift maybe the structure of the program to better serve these underserved communities.
Thanks. Yeah, that makes me think of this term I recently learned of, targeted universalism, which is the concept of basically taking a targeted approach to designing a program or policy or whatever, or product or whatever it may be, to fit the needs of a historically marginalized or excluded group, but ultimately having something that works for everyone. So these types of low-income pre-weatherization programs are definitely fit into that category. So that's a great parallel to make.
Yeah, sorry, one more thing. There is a tension around this where weatherization programs, energy efficiency programs are oftentimes statutorily required to report on energy savings, and are often not given the resources needed to track much more than that. So there is a tension that we see with wanting these programs to track more than just energy savings, to make these types of cases like we should be investing more in these communities, or we should be taking a more holistic approach. Some of that may require statutory changes in order to allow them to happen.
Definitely. I mean, we've seen some states try to implement cost-benefit tests that take account of non-energy benefits, and then have kind of had to walk back that approach. So it's definitely a struggle in the regulatory sphere. I want to take a brief pause and just make a plug for the audience to share any questions that you might have in the Q&A panel. I know we've had a couple come in, so I want to turn to a couple of those now, but please, if you have any questions, submit them and our panelists will be happy to answer them. But one question that I wanted to highlight that came from the audience was, how do contractors participate in these programs, and how is outreach done, and is there a workforce development component to any of these programs? So whoever wants to go first, feel free to hop in.
I'll go quickly. So we do not yet have a workforce component of it, but we are seriously talking about it because Delaware, like probably the rest of the country, is seeing a shortage of qualified contractors. And so it is a tough nut, but we are recruiting them. And in some instances, I believe Habitat for Humanity being one of them have actually starting up some of their own crews. But I'm glad you mentioned the job part of it, because I think we're going to be committed to putting some money towards job training in the energy efficiency green job space to help alleviate that. But we are finding contractors is a weak link.
It's kind of an interesting situation. Obviously, we have the same challenge with finding qualified contractors. There's like 5 that work within our region. It's crazy. But we are actually starting to also see some of the organizations that participate in the collaboratives do a lot of the work themselves and self-perform. And I really appreciate that too, because I think that the contractors can be a part of the decision-making process and or at least hear important parts about, the homeowner's story or whatever that that they should know about if they're working on the project. So I think that that's been an interesting trend, during this challenging time of finding outside contractors. Just I appreciate that they're able to do that. And yeah, in terms of the workforce piece, it's a little bit different, but I think it's really interesting. We partnered with the city of Durham in Durham County. They actually, it's kind of a separate program, but they are trying to deal with their code enforcement violations for low-income homeowners by basically referring them to this collaborative because they don't have the funding to necessarily fix the violation. But this collaborative has been able to engage with them, and they're not really traditionally contractors, but for, you know, non-licensed work, like building a ramp or something like that, they've actually been really good at engaging community members as a way to build community engagement. Especially, this is particularly an issue in areas of rapid gentrification within the city. So they're trying to get old and new residents kind of to work together to do this. So not really contractors, but a unique situation, and we're definitely getting involved with them, but more usually after, you know, the projects are obviously selected.
Yeah, and I'll say we've done some work on workforce development and training. And then there's a couple of things I want to point out. One is there are like the measures that we talk about that are like health and safety measures that are often reasons for deferral. There aren't like required trainings for folks to take besides with lead, because lead is sort of its own beast, right? It's a well-recognized hazard that, you know, you have to do right or else you make it worse for the child. But there is a demand for trainings that help auditors to be able to identify health and safety hazards, or help contractors be able to address these types of issues. And so we've put together different training curricula to help with that. One is the BPI like micro credential, which is it's its own credential. It's sort of something you can get in addition to the energy auditor credential. But then we also have a suite of like healthy homes trainings to identify asthma triggers, or aging in place, or trip and fall hazards, and other, you know, indoor air quality issues. And there is a demand for that in amongst folks who work in these programs, but they're not required as of yet. So one of the opportunities that we see, particularly as it relates to partnerships with healthcare, is that, you know, they want to see that they want to know that this work is going to be done to a certain standard that's ultimately going to result in improved health. And to do that, they're looking for some sort of training and certification that these folks can get. So there's an opportunity there. And I want to point out that we've done outreach to basically what Tony mentioned, not just Delaware, but all across the country in places that we've worked. There are shortages of qualified workers, and where the deficit often is in, you know, communities of color or other underserved communities. So we have to do deep outreach in those communities, and we've done that at some of the technical schools, or at high schools and community colleges. And all that outreach doesn't always result in people who are interested in this work, but we found that it's necessary in order to get the word out about these jobs as possible career pathways. So there's a lot in terms of workforce development and training that I think we as a field can continue to foster, but I think it does take more partnerships, more resources to be able to do it right.
Absolutely. And as we talk about partners and get back to the theme of kind of partnership for today, I wanted to know how having these partnerships made these programs different from others that you've run and more successful, perhaps. I mean, I think in my perspective, they seem to be more successful than others. But then also at the same time, what are some challenges that this model has presented for each of you? Erica, do you want to start?
Yeah, so I mean, in reality, our program would not exist without partnerships. I mean, that's what the grant funding was for. The collaborative work that was happening before was very informal, and usually not, it definitely was not like helping with efficiency. It was more about just, oh, I can't serve this person, can you? So that's, I think, kind of answers your first question. Um, I think this is probably the same for a lot of people, but our challenge is, it's actually really interesting. The two counties where we did the pilot project, one has somebody who is very well involved and manages the collaborative and has time and funding associated with it. And that one is really working very smoothly. Processes are being improved all the time. People are very engaged. And then the other county, which is more rural, it only has 3 providers. They don't have funding or time to have somebody run that collaborative, which you really need. And so, yes, they are working together out of necessity. And in some ways, we're able to better track data and all of that, but it's really kind of impossible to do this work, I find, because most of the organizations working on it are nonprofits with minimal budgets to begin with, unless you have that upfront funding and can identify savings down the line. So I don't know, the challenge, I guess, is just always getting more funding. And also, I don't know, I somehow feel like the better and more marketing we get for these programs, the more applicants we get, which just means it's great, but there's more people we can't serve, right? So that has been really challenging as well.
So the answer to that question for us, really, it was new for us to do a program where we're actually knocking on doors, right? We all hate the door-to-door salesman, right? They're knocking on your door and you're selling your roofs and siding and solar systems, right? And they're giving you the hard sell. And so I was reluctant to take that tactic, but we went into it in partnership with communities and we knocked on doors and we gave them a product. We did not do hard sells. But I'll tell you what was very surprising is how well it worked and how well it spread in a community. So if we were on the east side of a town working in a targeted neighborhood, all of a sudden we start hearing from folks on the west side of the town, they want it. It spread amongst police chiefs in Delaware because we were lighting up neighborhoods. So now we start getting outreach from different police departments or mayors or town managers hearing about this Lights On Delaware Strong program, and could you bring it here? So that was surprising how it spread, and I'm glad that we took a chance on doing a program that went door to door in a neighborhood, but I think you got to do it right.
I'll just say, I think inertia probably is the biggest barrier. Like, we're so used to doing and implementing these programs in a certain way that has benefited certain groups of people more than others. And to really shift that reality, I think we're going to have to shift the way that we deliver these programs. Yeah, I'll stop there.
I have a response to what you just said, Jamal, that I'm hoping happens, is I think we're going to find, as hopefully either new funding sources or requirements from funding sources change to show, that health is involved and energy savings related to climate is involved, that organizations will be forced really to make these changes to their programs if they want to continue or get more money and grow. So I'm really hopeful that that's going to happen. We've been able to obviously shift it to some point, but in the future, I would love for it to just be a given that we're going to be doing these like health assessments and energy assessments as a way to prove the good work we're doing and get more money and the savings from the work that we're doing, right, with healthcare and climate, energy. So yeah, I was just going to say that I think that's a big challenge, but I'm hoping as time goes on, especially in North Carolina, where I think we're on like the cusp of something, I hope. So if that's the case, then maybe the biggest challenge for us, which is the funding, right, will hopefully solve itself, maybe.
I mean, I'd like to ask my colleagues here a very quick question. I know if we have it, but how much are you working with manufactured housing or mobile homes? What percent is that, and what challenges do they give you? Because in our southern counties here, that is a big part of the issue, and are the least efficient homes.
Yeah, we haven't. I mean, it's a very small part of the work that we do. And to your point, like that is another segment of our population I think is underserved. So I would love to explore what that would look like, Tony.
So actually, we do have a couple funding sources that allow us, whether they're local or state, that allow us to do urgent repair work on mobile homes. And I do know that, weatherization comes in afterward on a lot of those. They are not eligible for all of our programs, which clearly, creates a barrier. But I do think that our ability to have not just service providers, but referral partners, local government partners at the table when we're talking about, projects and challenges is those local governments can say, oh, we know there's a lot of pressure on redeveloping manufactured home parks, and we are going to do something about it, or we're going to create a local source of funding to address that, because they're hearing it from every single person in this room. So I think that's the one benefit that we've had with manufactured homes, is like, luckily, if there's not a funding source, we have the power behind and the proof and the applications from manufactured housing to show that it's a need. So that's helpful.
Thank you.
Thanks for that question, Tony. That was great. And I think we only have a couple minutes left now, so I think we're going to end our conversation on that note. That was an amazing conversation. Thank you so much to each of our panelists for providing your perspectives. It was very valuable, and I hope our participants got a lot out of it as well. And I think if you would like to connect with any of our panelists, please feel free to shoot me an email, and I'd be happy to connect you with Jamal, Erica, or Tony afterwards if you want to hear more about their program. But also linked in this slide deck are a few resources on each of their programs if you'd like to explore them further. And then I also just wanted to highlight before we go a few upcoming NEEP resources. We have the residential labeling dashboard, which is coming out soon, which is a sort of partner project to the benchmarking dashboard, which is getting updates coming out soon as well. So keep an eye out for those. And we also have Recognizing Energy Inequities for Building Decarbonization, which is a story map, and near-term solutions for centering energy equity, which is a brief that kind of go hand in hand and exemplify a lot of the research that I've been doing over the last few months on how to equitably decarbonize our building sector. So thanks for joining today, and we look forward to seeing you in the future. But thanks again to each of our panelists.
Thank you.
Have a good one, everyone.
Thanks, Tony.
Thank you.
Thanks, Erica.
Bye,
Thanks,
everybody.
Emmy.